Congress could soon take up new legislation to help suicide prevention programs. Senate Democratic leader Chuck Schumer is calling on the federal government to increase funding and create more resources to reduce the number of suicide. Now, this comes after a CDC study found nearly 45,000 people died by suicide in 2016. It is the 10th leading cause of death in the United States.
The recent high-profile deaths of Kate Spade and Anthony Bourdain sparked a national conversation about mental health and suicide prevention. It's a topic we've covered and will continue to discuss here on CBS This Morning. Dr. Christine Moutier, a chief medical officer at the American Foundation for Suicide Prevention, is with us. Good morning, doctor.
Good morning.
You've said this should be declared a national health crisis. Why should it be declared a national health crisis, and what exactly would that mean?
Well, suicide has been in the top 10 leading causes of death, and it is a generally preventable cause of death. And that has been for a number of years.
It's higher than the homicide rate in this country.
That is correct. And as the CDC report pointed out, it's been on the rise since 1999. So I think the issue is that as a nation, we have not been paying attention. It is happening every day, every week. We suffered the tragic loss of 2 high-profile individuals. And yet every week, 865 Americans are dying by suicide. And so, again, this is the moment. We are ready to pay attention. People are asking the right questions. And there is a science to inform a strategy. And there is advocacy underway.
I keep hearing that suicide is a permanent problem, a permanent solution to a temporary problem. Is it correct to assume that everyone who commits suicide, and we'll talk about that too, because I know you all don't like that phrase, correct to assume that they have mental health issues? Couldn't it be you're so stressed about something and that you're not mentally ill? Or does it mean that you have a mental health problem?
Well, 1 in 4 Americans is living with a mental health condition, and less than half of them are having it addressed, diagnosed, and treated. So think about the millions of people also who experience incredible stress, loss of job, relationship strain, financial strain, and more trauma.
And don't take their lives.
And don't even have suicidal ideation necessarily, let alone die by suicide. So there have to be other risk factors that come to bear, and mental health conditions and some aspects of the brain. There is a neurobiology behind suicide risk. It is complex, but it is a health-related outcome.
I think we're all have been looking for signs that someone may be depressed to the point that they may be suicidal. And in part of the reading, I've learned that there are words that people use who may be suicidal. What are those words?
Well, when a person becomes so distressed, someone becomes suicidal not because they are necessarily wanting to think about death. They're in pain, they're in despair and anguish. And in that moment of extreme distress, their cognition actually narrows into a bit more of a tunnel vision. We think of a constricted sort of thinking. And so the idea of taking their life is a solution in that moment. So
there are things like, this is not going to get any better, or there's no way I can change this,
yes,
right? Those types of thoughts.
I would advise everyone to understand that we have been socialized to hide our distress. We function through a lot, and that can be a good thing to a point. And so subtle changes in a person's behavior will possibly tip you off, and I would trust your gut instinct. You know the people around you in your life, and you know their patterns. When they're isolating, withdrawing, their sleep starts to change, they're drinking more, using more, losing their temper more. Those all are indications very likely that their mental health could be shifting and deteriorating.
What other kinds of cultural and societal shifts have taken place that are outside of the neurobiological piece that we need to be thinking about it in terms of this?
Right. We think about this rise in the suicide rate. This comes at a time when the American public is actually wonderfully more open-minded about mental health being a part of health. Now we need to deepen that to a greater level of literacy and sort of actionable strategies. But the societal reasons, we believe, have to do with, because suicide is multifactorial. So economic changes, access to lethal means, including the opioid epidemic that we're in right now. Just that infusion of an easy access to lethal means can drive up a rate.
Someone stopped me on the street and said, I wish you would stop saying committed suicide, because that is the wrong thing to say. Why and what should we say?
Thank you so much for raising that. Yes, there have been tremendous advocacy efforts. The AP style book has changed and advises against the phrase committed suicide, because if you think about the term committed implies a criminal act, a moral act, committed murder. And suicide has been vastly misunderstood over the years.
What should we say?
We should say the person took their life, died by suicide, ended his or her life. Plain language, no judgment.
Yeah, well, we're going to continue this conversation. Thank you so much, Dr. Moutier. Thank you.